The equipment that you'll need for the tracheostomy includes straight and curved hemostats, appropriately sized suture, umbilical tape, scalpel handle with blade, and Mayo scissors. You'll also need a tracheostomy tube, either with or without a stylet. Place the patient in dorsal recumbency and pull the head back and down over the edge of the table, exposing the trachea. Incise from the thoracic inlet all the way to the larynx. Once this is incised, use your Mayo scissors to bluntly dissect parallel to the trachea down to the level of the muscle bellies. Once the muscle bellies are exposed, use your fingers to separate them along their midline attachment, and underneath you should be able to see the trachea. Remember, you don't need to name the muscles, you just need to separate them. Make sure to identify the neurovascular bundle running on either side of the muscles alongside the trachea to prevent cutting them. And so here you can see the neurovascular bundle running along the side of the trachea. Once these have been identified, bluntly dissect underneath the trachea using either a pair of hemostats or scissors. Punch through to the other side and use this to elevate the trachea from the incision. You're now going to count tracheal rings. Count from the larynx caudally, and count down to tracheal rings 4, 5, and 6. To make a longitudinal tracheostomy, incise longitudinally through the cartilaginous rings on the midline, staying away from the neurovascular bundle, and you will cut through between 2 to 3 tracheal rings. Once the trachea is incised, you can now insert your tracheostomy tube. If you prefer to make a horizontal incision, this will be made normally in the same area. We'll go farther caudally for demonstration purposes. Incise between the tracheal rings, encompassing no more than 50% of the diameter of the trachea. Similar to before, you can now insert your tracheostomy tube. Once your tracheostomy tube is in place, you should place stay sutures around the tracheal rings. If you're doing a longitudinal tracheostomy, you're going to encompass 2 tracheal rings in each stay suture, and these stay sutures should be approximately 1 centimeter away from your incision. The tag should be left long and loose so that in case of emergency, you can grab hold of the stay sutures and pull the tracheostomy incision apart while inserting a new tube. To place stay sutures for the horizontal incision, you want to go 1 tracheal ring away from where your incision is so that your suture does not come through the incision, and encompass 1 ring caudally and cranially. I could probably cut some of this out right here. Okay. Again, remember to leave long tags. Once the stay sutures are in place, you'll need to tie the tracheostomy tube to the patient so that it does not become accidentally dislodged. To do so, pass umbilical tape and tie it to either side of the tracheostomy tube. This will leave a very long middle section hanging around the patient's neck. You should then cut the center of the umbilical tape and tie it snugly around the patient's neck on the dorsal aspect of the neck. That way, if there's an emergency, you can immediately cut the tape and pull the tracheostomy tube. To close the incision, Simply close the subcutaneous layers and then the skin with skin staples or sutures.